Let's take a little deeper dive now into the quality reporting program and the quality measures. HHQRP was implemented January 1st of 2007. Home health quality data was being collected with the OASIS data collection instrument. Remember again, we've talked about the two different categories of quality measures that are appearing in the HHQRP. Outcome measures, the end result of your care. Process measures, the evidence-based means that you use to achieve those ends. Outcome measures assess the results of the care that you provided that was experienced by your patients. The data for the outcome measures information is derived from your OASIS assessment information, the data that you collected and submitted. It also includes some Medicare claim-based information. Only the assessment-based measures are included in the Review and Correct report. Do you remember the definition for process measures? They evaluate the rate at which you have used specific evidence-based processes of care. The QRP process measures are focused on high-risk, high-volume, problem-prone areas for home health care. Does that phrase sound familiar? This is the core of our new quality management process in the new COPs as of January of this year. High risk, high volume, problem-prone areas. The data for the home health process measures comes from the OASIS assessments that you have submitted. We're not going to go through these lists over the next 3 slides, but this is a complete listing of the quality measures themselves. You want to take a close look at this at another time and identify which of these are outcome and which are process measures. And remember the definitions as you're looking at these different measures themselves. If you want to have a complete list with more information, again, this is a live link below. When this presentation is over, take the time to go into each of these websites, take a look at this information, because this is critical for you to understand what we are talking about. Remember those polling questions? We're back. It's time for our first knowledge check to see how things are going. Your polling screen has just popped up on the right-hand side. As soon as those questions appear again, we would like you to look at and check off in the little round circle next to your answer. The Review and Correct report includes which of the following measures? Claims-based, assessment-based, or above? Well, it's looking like 73% believe that it is both Medicare claims measures and assessment-based measures. If we are ready, let's take a look at the answer. Assessment-based measures are in the Review and Correct report. The claims-based measures are not in there. Let's move on. Let's try another question. The Review and Correct report can be accessed through ASPEN, NHSN, KEYS, or CASPER. Click in the circle next to the answer that you believe is correct. And it looks as though 95% believes that it is the CASPER reports. And they would be right. Let's move on to one more question. The quality measures included in the Review and Correct reports are classified as outcome, process, both A and B, or none of the above. The polling is up. Let's take a look. Outcome, process, or both? 92% are saying that it is both process and outcome measures, and they are correct.